I'm Dr. Vinita Keshri. Today I'll be discussing about the ankle block. There is no conflict of interest and images from various sources have been duly credited. Ankle block is indicated for foot and ankle surgery below the level of malleoli. Ankle block is a relatively easy block to learn and perform. As the muscles of the leg are not blocked, the ability to ambulate is preserved. Ankle blocks can be performed bilaterally and are preferable for daycare surgery procedures. Even in individuals who are severely ill, the procedures of foot can be performed safely under ankle block. Success rate is highly improved with the use of ultrasound, and it makes the procedure less painful. Although there is a limitation to ankle block, that is application of tourniquet. If the durations of surgery is small and the ankle tourniquet can be applied, then ankle tourniquet at a pressure of 200 to 250 mmHg is comfortably tolerated with mild IV sedation. But in case where the calf tourniquet is required, higher popliteal sciatic nerve block is required. The complications with ankle block are extremely rare. Transient paresthesia is seen in 0 to 10% of the cases, which resolve on their own. The incidence of local anesthetic systemic toxicity is extremely rare owing to low levels of local anesthetic in the blood. Now, ankle block is not the block of single nerve. It comprises of blocking 5 different nerves. Of these nerves, one nerve, that is saphenous nerve, belongs to lumbar plexus. It is a continuation of posterior division of femoral nerve. The other 4 nerves, namely tibial nerve, deep peroneal nerve, superficial peroneal nerve, and sural nerve, are originating from sacral plexus, and they are divisions of tibial nerve and common peroneal nerve. Now, discussing relative location of nerves around the ankle joint, going from medial to the lateral side. First nerve that we encounter is the tibial nerve in the posterior-medial compartment of the ankle, and it is associated with posterior tibial artery. It is situated beneath the flexor retinaculum and is a deep nerve. The second nerve seen on the anterior aspect of medial malleolus is the saphenous nerve, and it is accompanied with great saphenous vein. The third nerve is the deep peroneal nerve on the anterior aspect of the ankle joint, and it is accompanied by anterior tibial artery. The fourth nerve, that is the superficial peroneal nerve, is the only nerve that is not accompanied by any major vessel. It is located anterior to the lateral malleolus and is a superficial nerve in the subcutaneous plane. The fifth and the last nerve is the sural nerve, which is located posterolateral to the ankle joint and is accompanied by the small saphenous vein.